I wanted to educate everybody on a topic or a problem that I see every once in a while that I call dissolver-induced dysmorphia or heat therapy-induced dysmorphia. So body dysmorphia or facial dysmorphia, what it is a problem that some people can have seeing issues within their own face that nobody else can see. We call that body dysmorphia because it is only seen by them, not seen by somebody else, which means that the general public or population would not see the issues that you're seeing. And they are either issues that are so small that nobody sees them, or they really don't exist, and you just kind of fixate as a person on this problem. There's a subset of patients now that exist in my book that are called dissolver-induced dysmorphia or heat-based therapy-induced dysmorphia. And what happens is these patients develop a dysmorphia that's very hard for other doctors and people and friends to understand after getting dissolvers placed in the mid-face or after having heat-based therapy like Ulthera that can actually shrink the fat in the face but not really shrink the skin to the same extent. And I've seen that commonly with either over-aggressive heat treatments or using kind of older devices like Thermage or Ulthera. It can happen when the energy is cranked up high. People who use them appropriately typically don't have that problem, but if you do repeat treatments or very aggressive treatment, you can have those problems because you lose the control of where the heat is being delivered and it melts too much fat, or even the SMAS and the fat layer can get scarred in the face. When this happens, you get a deflational change, which changes the character of the pores in the skin, the radiance of the skin. The skin becomes more dull looking and it starts to look collapsed. So you end up getting deeper nasolabial folds, deeper malar septum or nasojugal groove, and even your neck and jawline can get a little bit worse because of the increase in laxity. And what has happened is the hyaluronic acid, if it's dissolver, in the SMAS or the dermis, which is where it exists in the midface, can actually deflate and shrink. And when that happens, you lose that resilience in the skin and you can actually get slight collapse of these areas. It doesn't happen so often in the under eye or the lip, where there's not as much hyaluronic acid sensitivity. In the lip, there's certainly a lot of hyaluronic, but you can fix it pretty easily. And it's very difficult to go back and replace filler to fix it because filler is not a natural hyaluronic acid. It does not sit in the same level, does not do the same thing. So these patients tend to go through cycles of worsening and worsening as they start chasing this problem. They go and dissolve more and more or do heat-based therapies to improve it while their skin is still damaged underneath and they've lost all their hyaluronic. So it keeps worsening the problem as they chase it more and more, and they keep seeing it deflate, and they think they're getting fullness here and they keep trying to deflate it, but it's not fullness, it's just collapsed skin. It's collapsed lower down and they chase it in the midface. So this is a problem that I see every once in a while, and I identify it very quickly, try to explain to the patient, you have this issue and you have to be very aware of it, or every time you see a doctor, they're gonna have a very difficult time understanding how to improve you because it's such a vague change that occurs. And it's only a doctor who saw you right before and right after who could actually identify it. Otherwise, you will be lost trying to chase this forever. In those patients, when I treat them, I say, listen, I cannot restore you to how you were. If you're gonna wait for your own hyaluronic acid to return, it can take up to 3 years if it restores. If it's scarring that occurred in the face from heat-based therapies, then you can't really get any restoration of that. So I tell them, I'm not gonna turn you back to what you were, I can't. While you wait these 3 years, you're also gonna age 3 years, don't forget that. What I can do is try to improve you from where you are now. Your problem now, if you agree with me, is that you're starting to collapse, you see this cheek falling down and the jowls have gotten worse. What I can do, even though I can't reverse it, is I can do a heat-based therapy called Profound, which is the safest single-time strong therapy that you can do in all the radio frequencies. It's very different than all the other radio frequencies. And afterwards, I'm going to try to avoid refilling you because when you refill these patients, they have lymphatic impairment drainage problems and they're very sensitive to filler more than you think, and they end up dissolving it again. So you don't want to fill these people. So what I do is I do Profound and I try to do NanoFat and PRP. If they need a touch of filler here or there, fine. Otherwise, I do NanoFat and PRP to help heal better during that time, and possibly if they have any dense fibrosis or deep scar tissue that's formed over that time, the NanoFat and PRP can actually soften that slightly. And it's real PRP, meaning we don't take 10 cc's or 10 milliliters of blood, we take 120, and we take out 10 milliliters from that, and that's platelet-rich plasma. It's a 10% yield. The NanoFat, when you add it in, enhances whatever the platelets are doing. The NanoFat is a substrate-rich medium of adipose-derived stem cells, they call it. It's not a real stem cell, so I don't think you're getting a stem cell, but it does have growth potential and healing properties to it, which do aid in the recovery of doing another heat-based therapy to treat prior heat-based damage. So it's a very tricky thing to navigate for doctors, but it's good to be aware of it. Please do not underestimate the power of dissolver, especially in the mid-phase. Always exercise caution and realize that dissolvers typically that are in the mid-phase that you're trying to get rid of are going to be Juvederm and Voluma. Usually Voluma is the more frequent one that I've seen because it requires multiple dissolver treatments because it's high-cross technology. It's harder to get rid of. So have caution in these situations. I like to just do Profound on people to shrink the faces down by tightening and then increasing the metabolism for filler rather than trying to dissolve it with an actual dissolver. Okay, so under eyes I dissolve all the time, lips I dissolve all the time, but it's treacherous territory. You have to be very, very careful dissolving people. And these patients, they get dissolved, they get heat-based treatments afterwards. You're just aggregating the problems. They also sometimes get Kybella, and now you've just sprinkled crack on it. Kybella on top of these things, you end up with indents in the face or really deep melolabial folds that you can't improve. So everybody just be careful and realize if this is you, it's the cycle that's making it worse, and hopefully you can stop the cycle before it gets worse and let your body heal. The body healing is the number one thing that we can do, and then we just add little tiny things on top of it without making you worse.